Welcome back. To complete our discussion on stroke, joining me again is Dr. Justin Thankachan. He's with St. John's Health System, internal medicine and stroke hospitalist. Now, this is the really important part to treatment if a person gets into difficulty. Before we start really with treatment, tell me, I wanted to ask that question, can a person have a stroke and not know it?
Absolutely. There's a third, or not necessarily a third category of stroke, but one that I'd like to talk about is called what people would refer to as mini strokes, or medically we'll call them TIAs, or transient ischemic attack. And that's the same thing like a stroke, except that whatever reason, the blood disruption to the brain has been restored in a timely fashion where it happened quick enough that brain cells did not die. That would be one way where a patient might have these symptoms and not really think of a stroke, and then they tend to go away, so they thought nothing of them. And then there's people who do have strokes that are in certain areas of the brain that don't allow it to be shown, or they don't realize it.
Okay, and so even some of those signs and symptoms, we will repeat those again in a bit, that you mentioned before, the person can have just a modified version of it,
Absolutely.
Or it could be a brief headache and not something that kept going for them to feel like this is a problem.
Sure.
Okay, now I do want to get you back to one thing, because in our first segment I kind of pressed you, Doc, there on how long can this brain live before there's some damage to it, and you said it just depends.
Sure.
You just clarified just a moment ago with that transient ischemic attack how there can be some interruption, but very brief. It gets restored, so there's really not a lot of damage to the brain. Now clarify again for viewers this concept again of how long the brain can die, because we hear in other things a certain amount of time.
Sure.
But you were mentioning before, stroke, it varies. Sure. And it varies because of other ways of the brain getting oxygen?
Absolutely. The way it varies is when a person is undergoing an acute stroke, especially the ischemic kind, you lose about 2 million brain cells per minute. That's about over 33,000 brain cells per second.
My goodness.
And that's a fascinating number. But unlike, where we talk about anoxic brain injury or people who drown and stuff like that, your heart and lungs are still continuing to work, but your brain is amazing in the fact that it has alternate or different pathways of getting blood to the brain. So even if you have a stroke in one area of the brain, the rest of the brain should be capable of supplying blood not only to their areas, but sometimes even to the affected area.
Okay.
So it's very difficult to say how long a brain can survive in a stroke setting, because like we said, sometimes you might not even know you had a stroke.
Right.
It just all depends on where the blockage is and how large the vessel is that's being blocked and what that part of the brain controls.
Okay, excellent. Now, treatment. You talked to us about what's going to happen if we're calling in ahead of time or take ourselves in when we know that there's a problem or thinking about it. What are some of the treatment strategies that can be used? Because sometimes people feel like if you've had a stroke, that's just it.
And not too long ago, that was it. Until recently, it was not uncommon for physicians to deal with strokes by dealing with the devastating consequences of a massive stroke.
Okay.
There wasn't many things that we could offer. But in 1996, the FDA has approved a new medication called TPA, or tissue plasminogen activator. And in certain patients who meet the criteria, and meaning they don't have any exclusion criteria, because there's quite a few patients that we can't give it to.
Okay.
People who've had a bleeding stroke in the past, or a recent stroke, or major surgery. As long as they don't meet any of the exclusion criteria and they're a candidate for this is a medication that could potentially save their lives or greatly reduce the amount of disability that they have.
Okay.
But the problem with this medicine is that it can only be given within 3 hours of the onset of symptoms. Meaning when a person has a stroke, they have to not only know that they've had it, but know time that it happened. Because if you wake up with it, we don't know when the stroke started. It could have started right when you hit the sac, or it could have happened right before you woke up. So unless we know clearly when the stroke happened, we have a 3-hour window from when it started to you arriving at our facility to administer this drug. And it is so sad because it's very frustrating for physicians, because we see a lot of potential cases that we could give this medication to that don't receive it. And the number one reason they don't receive it is not because of all these exclusion criteria, it's because they do not get here in time. Time is of the essence. It's not something where you want to wait and say, I'll just take a quick nap, I'll be fine, I don't want to be a burden to anyone. Call 911, get help immediately. It's better to be safe than sorry.
Now, what does this, because this sounds like a miracle drug, as long as they can get within that 3 hours, what is it really doing? Is it reversing some of the damage? Is it minimizing? What is it doing?
What it does is, perfect word is what you hear people talk about. They refer to these drugs as clot busters, and what it does is it activates part of your body's natural response system, because every clot in your body gets eaten away or dissolved.
Okay.
And what this does is this is a drug that'll actually literally dissolve the clot right at the site.
Okay, wow. So time is definitely of the
Sure.
essence once again.
Absolutely, because once the damage has been done, once those brain cells have died, giving the clot buster will not help, and in fact it can be dangerous because it can convert or change that lack of blood stroke into a bleeding type of stroke, because now dead areas of the brain are now getting fresh blood,
Okay.
and those arteries are no longer able to hold it within its space.
Okay.
And so time is of the essence.
Now let's say for the individual where they did not get that particular drug, what are their options for treatment? What are you going to do?
If you do not get to us within the 3-hour window, it doesn't mean that all hope is lost. There's still time is of the essence, because if you can arrive within an 8-hour window, there are FDA-approved devices that are catheter-based, meaning one of the interventional radiologists or stroke neurologist or a neurosurgeon can take a guide wire, a catheter, and try to physically remove the clot itself. But once again, we're limited by time. These devices are only approved by the FDA for use up to 8 hours after the onset of a stroke. And in certain cases of such as a brainstem stroke, they can be extended up to 24 hours after the onset of symptoms.
Okay, so time is again of the essence.
Absolutely.
Now let me ask this in our last minute that we have here. People may wonder, if they've had one stroke, are they for sure going to have another stroke?
For sure, no. That's where treatment for stroke comes into play. Prevention is where, an ounce of prevention is worth a pound of cure. And what we try to do is identify as many of these modifiable risk factors that we can. We'll watch their heart, make sure they don't have an irregular heartbeat that would predispose them to forming blood clots. Or, we'll make sure their blood pressures are controlled, diabetes, cholesterol. If they're smoking, we tell them to quit. And if they haven't started smoking, don't start. And we try to identify as many of these risk factors to reduce the risk of a stroke, because it is true that once you've had a stroke, your risk of having another stroke is higher than a person who's never had a stroke before.
Okay.
But that doesn't mean you necessarily have to have another stroke.
Exactly.
And our hope is that you do not.
Exactly. And would the person also be on blood thinners for life? Because you're talking about clots.
Sometimes they might
Sometimes.
be. It depends on they will be on some sort of either an antiplatelet agent, or they might be on an anticoagulant, meaning to thin the blood down so that they're less likely to form clots. Those will all have to be tailored on a patient-to-patient basis, depending on their risk factors.
Okay. Thank you so much, Doctor. That was a lot, but we got a lot in, and
this is my
remembering
pleasure.
time is of the essence.
Absolutely.
Thank
Call
you.
911, do not wait.
Thank you. Well, that's our show. For Health Alert, I'm Pam Butler. I'd love to hear your comments, questions, or suggestions for future shows. Please write me at Health Alert USA, P.O. Box 50913, Tulsa, Oklahoma 74150. Or if you're on the email trail, please email me at healthalertusa@gmail.com. And also visit me on YouTube at YouTube/Health Alert USA. Take care, and remember, time is of the essence. This program would not be possible without the support of OU Physicians in Tulsa.